preparing for surgery is a whole different, ball game from what it used to be or what people expect. So one of the first things you're going to do is we pretty much have everybody anymore meet with our preoperative clinic. They're going to do a full screening. This is going to be a detailed head-to-toe exam, detailed physical history, all of that. And we're just kind of making sure that we're not going to discover anything we don't want to discover during surgery as far as your heart and your lungs and your ability to tolerate it. The other thing we're going to do is if you have surgery with me, is you meet with me and I go over the procedure, I go over the details, risks, benefits, all of that. And that can be a very intimidating time because we throw a lot of information at you. So I always encourage, before I get into my spiel, I always encourage, stop me, ask me questions at any time.
Should I rest before my surgery?
One of the common misconceptions that I think I get a lot of is people say I should be resting for surgery. And that's about probably the worst thing you can do. You want to think of surgery as like running a marathon. So not that you have to go out and join a gym or start training, but you want to start building yourself up. So I recommend a 20-minute walk every day.
How can I get my body ready for surgery?
Just stay active, live your normal life, increase your exercise a little bit. Even just a daily 20-minute walk you'll start to see benefits of it, and it'll help your body prepare for kind of the fight it's going to go through in the healing process of surgery. Other things, cleaning up your diet, focusing on less processed food. Again, go back to the protein. They're the building blocks of our body, so focusing on getting enough protein in every day. And then another big one is if you smoke or use nicotine, stop smoking or using nicotine. That is one of the biggest impediments to healing that we know.
How can my family help?
Bringing family members and caregivers are exceptionally valuable to these preoperative appointments for a number of reasons. First off, we're going to throw a lot of information at you, and having a second person, a second set of ears to hear all that can be helpful to remind you later. The second reason is they can come up with questions that maybe the patient didn't think of, especially when it comes to aftercare. The patient's usually thinking about, this is my problem or disease, this is the surgery, this is how I recover. They're not thinking about the things they're going to need or the help they're going to need after surgery. And those caregivers a lot of times will chime in and say, well, what kind of things do we need for home? Who needs to be there? Those kind of questions that are very important to answer and prepare for before surgery.
What about older family members, or if I don't have help at home?
When we get older patients or older family members, it's always a consideration. And one of the things I like to bring up is a short-term rehab stay. And it's not that we're trying to push people into them. It's not that we're trying to get people into nursing homes. But if you don't have the help at home to succeed, it's going to make your recovery harder. And sometimes just a week in one of those rehab facilities can make the world a difference, especially if you don't have someone who's at home or around who's able to help you as needed.
Final advice?
Ask questions is probably the biggest thing you can do to prepare for surgery. And bring a notebook, come in with some questions, write the answers down. If you have questions afterwards, if you're looking things up on Google or whatever and something pops up, don't be afraid to reach back out to your surgeon and say, I read this, I heard that, what do you think? We're happy to answer questions. We want not only for it to be a successful surgery, we want you to be comfortable, and we want you to be fully informed and know what's going on, because the more informed a patient is, the more they can prepare, and I believe the better the outcome they're going to